The last speaker in this opening slot is the Chief Operating Officer of the Healthspan Action Coalition. So that's all about empowering, listening to patients, growing that community interest in Healthspan. She is also the chair of the board of the longevity of the LEV Foundation. So please give a warm applause to Melissa King.
Is this mic on? Yes. Although you could probably hear me in Cleveland without it. So Dylan and Tina took the lav mic, so I'm using a handheld, and I kind of feel like a comedian. But I'm here to talk about something other than what I find funny. So I'll tell you about the Healthspan Action Coalition, which was founded about a year ago and then launched 10 months ago here at this conference in Dublin. Some of you may remember my colleague and our CEO, Bernie Siegel, speaking last year about the very new coalition at that point. What we're doing is nothing less than building a global societal movement around the concepts of longevity and, of course, healthspan. So, where do I come from? Why am I the person here telling you about this? Looking at the screen, that'll give you an idea of my ethos. Those are a group of patient advocates that were part of a project that I'll tell you about that I worked on in California in 2020, which followed a similar one that I had worked on in 2004. These are patient advocates, many of whom in that picture, I look at that picture, some of them would move me to tears and would move you to tears if I told you their stories. I see people who are living with chronic diseases, many of these diseases of aging that we talk about. So there's someone in there with Parkinson's. You can obviously see someone in a wheelchair. He does have a spinal cord injury. There's someone with MS. There's a woman in that picture who lost her husband and then her 3 adult children to Huntington's disease, and she is still on the front lines of advocating for medical research. She started an organization that's been enveloped into UC Irvine at this point. She was at the World Stem Cell Summit with the longevity sessions that we just put on earlier this year that Jyoti and Aubrey put together. She's still out there fighting the good fight to keep the funding going for research. So, what did we all work on together? What have I been working on for the past 20 years? Wow, it's crazy to be able to say that. Back to the jokes. So, in 2004, we did something that can be done in 26 of our 50 states in the United States, and that is we got a statewide ballot initiative passed that created, so that's the thing that you can do. You can do the closest thing to direct democracy that there is. You can go directly to the voters as a group of citizens and get something passed that then sets policy for the state and even can access funding from the state, which is the key. So in 2004, we passed Proposition 71, and that created the California Institute for Regenerative Medicine. Some of you may have heard of it. We call it Serm, not CRIM, as some people sometimes do, getting the acronym wrong. Serm, and the board is the Independent Citizens Oversight Committee, and I really prefer that you call it the ICOC and not the ICOC when you come to talk to me about it. Thank you. So we got Prop 71 passed. We got an initial $3 billion in funding for regenerative medicine and stem cell research in California. And the reason it was important at the time to do that at the state level is because, as you may remember, there was an executive order in place, put in place by George Bush, that limited a relatively new field, embryonic stem cell research. So stem cell is not a new field, but embryonic stem cells had really just been isolated in the late 90s. Jamie Thompson published it first. I think he was at Harvard at the time. He's now at Wisconsin. And so we're talking about 2003 when a group of people got together and decided they wanted to pass some legislation in California to try and get some state funding for this area of research that the scientists thought was very promising. And a bunch of patient advocates also that were very involved in their own organizations and were in touch with scientists and maybe even funding science also felt was very promising. And it was essentially being shut down in the United States because if the NIH isn't funding it with their biggest budget in the world for medical research, then it's really not happening in the United States, certainly not to the extent that it could. And at the same time, sitting in California, we have the fourth or fifth biggest economy in the world, depending on the economist you're talking to. I'm not going to get into that debate, and it changes all the time. And we also have a number in just one state, because it is a pretty big state, with a number of world-class institutions, academic medical centers and other research institutions like the ones that Aubrey tends to found, where wonderful research can be done. And we wanted to see the field get off the ground and grow in the country, and we wanted to be part of that engine. So that's why we created the agency. And what I did is, so I worked on the campaign, and then I worked with our state government, people in the controller's office and the treasurer's office, to figure out how to hire the first 10 people at a brand new agency. We just had to build it from scratch with no model. Then I took the board. I was on the staff side. I took the board, the 29-member board of people like you, through 1,500 hours of public meetings. So just imagine that in our first several years. And then I was there for 7 years, and it was really like a startup the whole time because we were sued. And if you trace the money, not to get into the politics, but it was the religious right that sued us. They thought they would shut us down. They didn't, but they kept us from being really able to award as much in grant funding as we would have been if they hadn't sued us, right? So we came up with some creative financing ideas to be able to get some initial grants out the door. And by the way, Jean Loring, who you heard from, I think it was yesterday, although I'm in a time warp, thanks Aubrey. But she was one of our first grant recipients, and that was for her to train other people to use stem cells, because at that point, most people, even in the science, the medical research arena, didn't know how to use them. Certainly clinicians didn't know yet. We're still working on getting funding to that, how to manipulate cellular treatments and do clinical trials. So anyway, I left and did some other things for a while, and then in 2018 was recruited back by the chair of Prop 71, who was then the chair of Serm while I worked there. I worked closely with him for those 1,500 hours of public meetings, during which, by the way, we set up the policies and processes and grant programs, initial grant programs, many of which are still in use by Serm. Their way of awarding grants and managing them has evolved, which I think is excellent. They've done a great job. But anyway, I was called back to the cause because the money was sunsetting, and that was deliberate. It absolutely was not supposed to be evergreen, and it was meant to get the field off the ground and get through probably the part of the, like through translation. It really wasn't meant to start funding clinical trials, but we actually did. And I heard this company mentioned here, I can't remember by who right now, by whom, but Geron. I think we were talking about Mike West, is that right? It was you, Aubrey, maybe it was you. So anyway, Geron, back in 2011, before I left Serm, got the first clinical grant ever from the agency. Didn't work out perfectly, nothing necessarily will, so that grant ended up being largely given back, and then years later, it was put back into the arena, and now a company called Lineage is still running that same program for spinal cord injury. But so I was called back in 2018 to lay the groundwork. I took back over a nonprofit called Americans for Cures that I had founded in 2004 at the request of the same chair, and with a lawyer. I'm not a lawyer. And I came back and took it over and used it as the mechanism to go on a listening tour to figure out what we needed to say in the initiative that we were trying to get on the ballot for 2020. What did the field need? What did the patients believe was needed? So we got that information. We actually were inspired in part by Aubrey, which is very interesting. There's a carve out, as you can see, and I'm not a slide reader, you can read, but we got another $5.5 billion. And there was a carve out from that $5.5 billion specifically for for diseases of the central nervous system. And the reasons behind that are, you know them better than I do, those of you that are scientists in the room. These are very difficult diseases to learn about and to try and develop a therapy for, let alone a cure. And a lot of Serm's initial $3 billion had gone into those diseases, but there hadn't been a lot of progress, and not because there weren't excellent people working on them. So anyway, just a very interesting part about public policy and how if you do something like direct democracy, go to the citizens with a ballot initiative, you can really affect what it says. Love what Dylan is doing as well, love to support him in that, get him patient advocates when he needs them for his work. And then there's what we were able to do at Serm and get this funding to continue the work, the $5.5 billion, because by the time 2018 hit, there were, I think, 70 clinical trials happening that Serm had funded, and another 30 that had been funded through industry or other sources, but that Serm had funded earlier stage research for. So anyway, I'm not going to read you about Serm's impact. I've already mentioned the number of clinical trials. It's now up to 95. I looked last night to make sure I had the right number. And just a little bit about how long it takes, but also that good results do come if you get enough funding in place for this type of research. You heard from Jean Loring, her work funded by Serm after her grant to train people, her work on Parkinson's and developing an autologous dopamine creating cellular therapy for Parkinson's is just now, in the last week or so, has been approved by the FDA to move forward with a clinical trial. And I think you also heard from Jean about regenerative patch technologies. That is a project that I've known about for 15 years. Shinya Yamanaka in this case it's Peter Coffey. Peter Coffey was brought from UCL to UC Santa Barbara to work with Dennis Clegg. For 6 months of the year, Peter Coffey spent his time with Serm funding at UC Santa Barbara, worked with Dennis Clegg, another scientist there, and then some doctors at USC to do a clinical trial for AMD. The dry form of age-related macular degeneration, and that started while I still worked at Serm, and now they're doing a clinical trial, and they also just got another $12.3 million from Serm a couple of weeks ago. I read the press release, I have to say, happily. So this field needs to get across the chasm. You heard someone say that yesterday. There's so much work that has to be done in this area, and that's what a coalition like the ones that I'm used to building and working with can do. The work of the wonderful scientists that we've been hearing from has to get across these valleys of death, and that means there needs to be enough funding for the field. So, and also, another problem, and we've heard a bit about this as well, regulation does not keep up with innovation. So we, plus Dylan, plus Tina, plus Andrew Scott, have to work with these agencies globally, locally, and also globally, to move the needle on regulation to make sure that it does keep up. So why is advocacy important? Again, I'm not a slide reader. There are some obvious obstacles to the success of this field. And there are many ways to measure success, but right now it needs more visibility as a field, similar to stem cell research. People need to understand it, and it needs to be broadly supported if you do want elected officials, appointed officials, to put favorable policy in place and to put proper funding mechanisms in place. So how would we measure the success of the field? Obviously, those three things, and increase funding. And you want the public saying, oh yeah, I totally know about longevity and I support that. Right now, they don't know about it. They might get worked up about it if the messaging is not quite as refined as it needs to be, but that's what we'll work on together. We want to get to that point. So the advocacy toolbox, this is a set of things. Oh good, it actually is pretty big on the screen. That's excellent. This is a relatively long list of things that are in the advocacy toolbox. You heard about some of it in earlier talks. I come from marketing and communications in the tech industry before I ever worked on the stem cell projects. And so I'm familiar with the communications piece. The collaboration is absolutely essential, and that's been talked about a lot in this room as well. And then really advocates can be proponents of, and even the creators of, creative ways of financing the research. So longevity advocacy is needed, and what I'm here to tell you is that I and my colleagues are here to have really big ears and listen to you. Because similar to listening to patient advocates, listening to those of you that are the insiders, the early adopters, those interested now in this conversation, that's how we're going to learn what we need to know to help you and help us develop the messages that we need for this time, and those will evolve over time. What are the stories that we want to tell about longevity science and medicine? This is what our coalition looks like now. We really want you to join it. These are our priorities. They're on our website, which you can find here. So my call to action for you today is get in touch with me and join the coalition. There's no financial ask. There's no, you must come to 2 meetings a year and volunteer 5 hours a week. There's nothing like that. We really just want you here and to be able to talk about you as part of the coalition and show people that you are. When people see an organization or a person that they're familiar with, it makes them much more comfortable being a supporter. And then we might ask you to participate with us in some advocacy work, but it would always be optional, I promise. So please do get in touch, and I will stop there. Thank you.